directly with people who are experiencing homelessness, which is exactly what we wanted to learn from the person. So thank you very much, Tim.
Thank you very much. Wait, let me. It works. Good morning, everybody. Can you all hear me? Okay. Okay. Good. So, I think there's. Ta-da. Okay. So I'm going to have let me go ahead and tell you a little bit about myself, and then we'll talk about what we're going to be talking about today. So, and let me get a little bit of input from you guys. So, who here is a volunteer at an organization that brings you? So, who here volunteers? Okay, a lot of volunteers. That's beautiful. Staff members, like paid staff members of an organization. Okay, great. And just community members at large that are interested. Okay, great. So my name is Tim Welsh, and I'm a social worker. I've worked at the Family Health Center for over 17 years now. We have 8 clinics in the community that work on a sliding fee scale, and we provide medical care, and at some of our locations, including the one I work at, we offer dental and behavioral health care. At the clinic that I work at, it's the Phoenix Health Center, which is over in the Phoenix Hill neighborhood just east of downtown. We work exclusively with those experiencing homelessness, and I'm a counselor there. So today we're going to be addressing several different aspects of working with homeless individuals. And later today we're going to be having a panel discussion. So if you all have questions, like if you all have specific encounters that you all have had, or if you've noticed more and more individuals, and you have certain questions about how to approach people, we'll have myself and 3 other outreach workers, so we can talk about approaches and stuff like that. So this morning we're going to be talking about engaging with others, effective communication, trauma-informed care, which is it's a model that's been around for a while. It's really just, I think, in the past 10 years been a focus here in Louisville. It's a big push in the social service community. Then we have de-escalation, and then safety. So a lot of individuals in this room, I won't ask you to raise your hands, but you may not have trained expertise in working with people with mental illness, people with substance abuse problems, people who are homeless. Like, you may not have had official formal training in that. So there's going to be a lot of safety things that I think are very important for everyone to know. These are points that I give to trained professionals all the time, and they're just, a lot of it's common sense, some of it is counterintuitive. All people here are caring individuals, and some of the things that you would do, like for a loved one, are not the things that you will be doing with these individuals. And we'll be talking about that. And again, it's for safety purposes. It's not because we don't care. In fact, again, some of this may seem counterintuitive, but we'll be talking about that. And then lastly, we're also going to be talking about resources. Let me understand this. So there is a handout. There's a couple handouts, actually, that are going to be available to you guys online. If you go to, I've been told it's on the Coalition for the Homeless website, or it's going to be there. There's a handout that you can print out, or you can just review it online, and it has virtually all homeless resources in there. So it has like our clinic, it has the shelters, it has the soup kitchens, it has outreach, and I know there are some outreach workers here today. There's a lot of resources available to you for that. So we'll be getting into how to access that and what's important in that. So why are we here today? What brings us to here today is the fact that in 2018, 2 years ago, we had about nearly 7,000 individuals who were served. That's distinct individuals who were served in various homeless agencies. So we have a significant homeless population. Private property owners and churches are seeing more and more homeless individuals come through, either during the day or at night. And again, most non-professionals do not know or do not feel comfortable interacting with people with substance abuse, mental illness, or homelessness. It doesn't mean that there's not the care, but there's just not an awareness, and that's what we'll be talking about today. Why are people homeless? Poverty is the primary reason people are homeless. I think there are contributing factors to that, but that's the number one reason. Triggers for homelessness: loss of wages, loss of jobs, lack of affordable housing. Right now, Louisville needs over 31,000 units to house, and the cost of that is staggering because for 31,000 units, the cost is $3.5 billion. So clearly, we have a great need in the community. And there are a lot, since I started 17 years ago, we have so many more resources than we had within the homeless community. And we have been able, because of housing first models and additional money from the federal government, we've been able to house hundreds and hundreds of people. But there are still thousands and thousands of people that we need to address. Fortunately, one of the things that really has spurred additional care in our community is Medicaid. When I first started, we had countless clients who needed surgeries and needed access to care, substance abuse treatment, but there was no access to insurance, and therefore those services were in desperate need. And luckily now, that's one of the things that we really have access to. Okay. Why are we here? We all want to have successful encounters with the individuals that we meet in our community. With appropriate training and understanding, we can increase the chances of them being mutually beneficial. And we have to remember that every encounter can have a positive result. Okay. Emergency services. So one of the things that we, I think, as a community can struggle with is knowing how to approach someone who is homeless, who's on our property. And each individual organization that you are a member of has to come to an understanding of where and what the rules and regulations are when it comes to how you serve someone who is homeless and what boundaries you have to set for them. Some organizations are fine with letting people stay overnight, like in a courtyard, while for others it's not okay. And I think the thing is that it's important for the organization to figure out what is and what isn't acceptable, because once you have those understandings, then you can convey that to individuals. I do think one of the things that was kind of discussed when we were creating this training is the idea of calling 911 is something that needs to be reserved for a true emergency. And so I think as we engage individuals, having that as an option, but one of our last options. Because for homeless individuals, the police are not usually their best friends. And the other thing is that a lot of our clients, you know, they're not just homeless. They can be a minority of any sort. And so we all understand in today's current environment how and that's not saying anything bad about the police, you know, but it's saying that we have to be very mindful of when we're bringing police into any situation, right? And so one of the things that we're going to be talking today and really focusing on is how we can de-escalate a situation, how we can be mindful about people's safety, and how we can communicate clearly so that the situation ends in a peaceful manner, so we wouldn't even need to contact emergency services. That's our goal. Okay. So we're going to primarily, right now, the initial part, we're going to talk about engaging people. And the good thing is that you all already are coming from a place of compassion and empathy. So that's not something that we have to teach. Sometimes I give this presentation for organizations where they have members of staff who are maybe having a little struggle with compassion and having maybe being burnt out. And so some of this will be, we've already crossed that bridge, so we don't have to worry about it. Let's talk about a compassion team. So a compassionate team. So with your organizations, for those of you who are encountering homeless individuals who are coming onto your property, I think it's very important to know who in the organization is going to be the ones who are engaging individuals. And to make sure, if at all possible, to do it in a team of 2, okay, for safety purposes. Now, it's not always possible. That's not always possible. You know, you might be the one locking up the church, and then you walk outside and there's a homeless individual, right? So it may not always be 2 people, but ideally, it is for the best, because it's always, I'm going to be talking personal experiences here because I'm on our Code Green team at my clinic. And so what that means is that when we have an emergency, someone's fighting or setting something on fire or trying to break the window, whatever the case is, the intercom system, they page Code Green to the lobby, Code Green to the lobby. So I, being on the Code Green team, I'll be going to the lobby. And it is super important that, for me, in those instances, and hopefully your instances will just be someone sleeping on your front porch and just engaging them, but is to have a backup, right? So there's Batman and Robin, right? So if I'm the lead, I can always look to Robin, right, and give Robin a signal, and then we'll be talking more about that. But key is 2, and you don't have to have a team of 10 people to encounter the one individual, right? We don't need to over-inundate anybody, but a team of at least 2 individuals is good. And because of that, it offers support. And the other thing is it's good to have a team because, for something like today, if you have a team of 5 people and they're the ones that always encounter the homeless individuals, they can educate the rest of the community, right, the church community or the staff or whatever, so they can better understand what is going on, and they can advocate for those individuals and their needs within the community. Okay, so let's talk about engaging. Always introduce yourself first, and then give the other individual or individuals an opportunity to either choose to introduce themselves or not. Some people are not going to want to talk to you. They're not going to want to engage with you. That's okay. They don't have to do it. But at least give them the opportunity to do so. Because the thing is that if you have done this work at all, even in a volunteer capacity, you'll know that you will encounter someone today and you may never see them again for the rest of your life. Or you may now see them every day for the rest of your life. So you don't know when you're walking into what you're walking into, what's going to happen, how it's going to turn out. Okay. Ask, is there something that you need? Open-ended question. Gives them the opportunity to explain. And a lot of people will say, no, thank you, and then they'll just get up and walk away. That's not always the case, but this gives them an opportunity for you to find out kind of what's going on here, right? And you may think you know what's going on here, right? You may have you may have encountered several homeless individuals, people experiencing homelessness, but I guarantee you, you don't know what's going on. until you find out what's going on. Because every day, I've worked at the same place for 17 years, and the individuals that I meet, even though they may look just like the other individual that just left my office, it's a completely different thing, right? It's a completely different thing. And how they're able or unable to interact with you in a positive way is going to be different. You don't know until you encounter them. The other thing is I think it's really important for all, especially volunteers, but also staff members, to know what you can do and what you cannot do, right? Because the thing is that we're all caring people, and we hate to see people in need. So sometimes some of us can go in there and just try to, oh my goodness, and we're going to just do all the things. Well, then they're going to, if you do all the things, as long as you can always do all the things, you're in good shape, right? And as long as you're willing to do all the things for all the people. And you can't do that. I mean, maybe you can. Maybe you have endless resources that I don't know about. And if so, please come see me at the break. Because I'd like to get your name and number for my resource booklet. But the thing is that in order to really, to continue caring and providing, you have to know what your limits are and what your boundaries are. Because if you don't, you will burn yourself out emotionally or financially, and then you'll have nothing left to give. So I think it is so important, whether you're with a church or outreach or whatever it is, to know truly what it is you're doing there and what you have to offer. And the other thing is to also know what your role is with that individual, right? For some of you, the role is just education. You're just educating them. I'm sorry, but you cannot sleep here. It's not safe, and I'm sorry we can't let you do that. You're welcome to attend our church service, which is Sunday at 10 and noon, and we have a church dinner every Saturday at 5 o'clock you're welcome to come to. That might be your piece. That may be what you have to offer. Or, and then now that you have this, you'll have this resource manual, you can say, is there a need that you have that maybe we can find a resource to help you with, right? So it's very important to know what your role is with these individuals, because the thing is that, if you don't know, I'm going in, and I've seen, especially volunteers come in, and that's the most social workers. We come in thinking, we're going to save the world today. And you go in there, and by 2 hours into it, you're like, oh, something's not working out right today. I thought we were saving the world today. But yeah, so define roles. And again, if you all have like a staff meeting, or however you all do meet, your committee meetings, is define what your organization is able to do and what your organization is not able to do, right? Because I think some church, we were talking about some limitations, and one was so during the day, we can't let people in our church, right? We have, we don't have enough staff members, and, so if someone says, hey, can I come in and use your bathroom? That wasn't an option for them. But that there's the public library right here, and they have public restrooms. So you can say, let's just go right over here. Again, educating. Again, knowing what resources you have. And so I think it's also super important to know what resources are available in the community. And we are so fortunate here in Louisville. We are so fortunate. Now, of course, the need is greater than the resources, but really, if you look at what is available, and what resources you can connect people with, it's pretty significant, right? We have several day shelters in town where people can take showers, do laundry. There's multiple opportunities to meet people to help with, try to get on housing wait lists, to get free clothes, to get access to tents and sleeping bags. And to get breakfast, lunch, and dinner. But the thing is that you need to be familiar with these things so that if you ask someone, is there something that you need, then you know where to go to refer them to that resource. So we'll talk more about that. And also the Coalition for the Homeless has the Street Tips book, which is there are small booklets that you can get from the coalition and easily just hand them out. And they have virtually all of those resources in there as well. Okay, we're going to be talking about communication. Okay. So number one, stop and focus. Make sure you have time, because the thing is that when you walk up on someone who is experiencing homelessness, it could take 2 seconds or it could take 2 hours, depending. So make sure you're not just on the fly, run through and say, you're going to need, because the thing is that it could turn into something very different. Like once you engage them, you might find out they have a broken leg, or that they need the ambulance to be called, or they're having some kind of other medical emergency. So if you advisedly make sure you have time to do those things. And then make sure, just be conscious of your body language with them. I think we'll be talking in just a little bit about safety and making sure that we're giving people distance and space, so that we're not up on people. That's never a good thing. We want to make sure that people are feeling safe and respected, and also that they have the ability easily to leave, and that their way out of that situation is not through you. Okay? It's because we always want to give people an exit strategy, right? Because the thing is that we're going to talk about shortly about trauma, and if people have been through trauma, certain things can trigger that trauma, and then they can react in certain ways. So we have to be very, very mindful and respectful of people's physical space, even though when they may be in our physical space, literally, like on our property. We have to make sure that we give them ample opportunity and space to exit. Okay, so pay attention to your body language and their body language. And the thing is that if someone wants to walk off, like if you're having a conversation and they're clearly in need, but they just get up and they just walk away, we're going to let, we're going to let people walk away. If they're agitated, we're not going to say, no, wait. I had a situation at work once with a client who was agitated. She was very upset. She was trying to get help with something, and the staff member thought, like, if the woman would just stay, she could help her with it. Well, the woman was getting very agitated, and she was like, I'm out of here. I can't do this right now. And she was crying. And then so she started to walk away, and the staff member reached out and grabbed onto her arm to prevent her from leaving because she wanted to help her. Luckily, the woman did not turn around and hit her, but she easily could have. And with clients, and we're assuming that every single person that I interact with in my job, and I'm assuming, and I'm going to encourage each of you to assume that every person experiencing homelessness has experienced trauma. Just being homeless is experiencing trauma. That you never touch a client like that. Especially if someone is trying to exit, then we're going to let them go, okay? And then they can come back if they need to. But we never want to do anything like that. And the other thing is, and I know that there's probably some huggers in here. Yay, huggers. My family were always kind of like we weren't huggers, but I know some huggers, and they just love to get up in there and hug on people. But if you don't know the person well, and maybe even if you do, I would strongly encourage you to be very mindful of people's physical space, because touch can be very triggering for people who have trauma. So we have to be very mindful of that. We can care from a distance. Okay. So keep your awareness on listening to the other person. Stay present with them, make eye contact, and respond with empathy. This is probably counterintuitive. I mean, this is very intuitive for you. You already know this stuff. Give undivided attention. Easy does it. Give yourself the time to try to figure out what is happening. Because the more they tell you, the more you know what to do with what they're experiencing. Just good eye contact. Be attentive. This is. Let's talk a little. We're going to get a little bit into safety here. If unsure about safety, meet in an open space. So this is what I'll do sometimes. So again, each of your situations are going to be different depending on how you're interacting with people. I think for me, if I have a client who is clearly agitated, so I have an office, I am not going to be bringing them into my office. Like if they're clearly agitated, upset, their tone is really loud, they might be using some interesting language. If I'm concerned about my safety or the safety of others, I'm not going to bring them into a confined space, right? Like if you're like, oh, I need that resource manual, it's on my computer, why don't you come on in here with me and we'll sit in this little small tiny space way in the back and no one knows where we are. No, that's not how I would be doing that. So if you know that there's an individual who's out there and they're agitated, maybe just make sure you know where the maybe put a resource street tip book in your pocket so you have it with you when you go out there. But I would not be bringing anyone into a confined space. The other thing is if they're already in a confined space, let's say someone brought someone in to use the bathroom, and then they come out of the bathroom, and we've had this where I work, somebody might use some substances in the bathroom. They were fine when they went in, but they're not fine when they come out. So in those instances, I will try to get them out of a confined space. So why don't you come with me? Let's come on. Let's go over here. Yeah, so what was going on? Oh, okay. And then we're going outside. And then we're out in the wild open spaces. So if the client decides they want to run away, they can just run away. They can run down the street. Or if you need to run down the street, you can run down the street. But don't box yourself in, and don't box someone else in. Like if let's say this was the corner of your fenced-in lot, and they're right here, and this is the only way out. So there's a couple of ways I would do it, but I wouldn't be just coming on up and say, hey, how are you doing today? What's going on? No, that's, and especially when someone's sleeping, you need to give them extra space, because, if you were asleep and someone's standing over top of you that you don't know, it could be a dangerous situation. So you always want to, maybe, hey there, hey, how you doing? What's going on? And then kind of as they get up, maybe encourage them to kind of come away from the corner. Again, it depends. But we just have to be very mindful of our safety and their safety, everybody's safety. And we don't want to escalate, and we're going to be talking about de-escalating in just a little bit. But there we go. The other thing is, I always say, so Batman and Robin, is have a code word. So whatever the code word is, it means you need to call the police, or something. That's what the code word means. So if I'm the Batman and I'm over here and and the guy over here is saying, I'm going to kill you right now. I'm going to look over to Paul and say, hey Paul, I do want to go to White Castle today for lunch. I really do. Yeah, right now. Oh, okay. Thank you. All right. So whatever the code word is, you all need to get that down pat. There was one instance at the clinic where we didn't really have a signal or something. We afterwards did come up with a signal. So I had a client who came in, and they were like, he came in screaming that he was going to kill somebody. I'm going to kill somebody. He just kept screaming over and over again. So I said, here, code green to the lobby. So went out to the lobby, and I knew the client. So we had two waiting rooms, the big waiting room and then a smaller women's and children's waiting room. So I pushed everybody out of the women's waiting room and put this person in. And so it was me and him in this small waiting room. And there was two doors. There was this door, and then there's this door. And over here, that door has like a little glass pane in it. So it's me and him. So I'm standing here, the client's here, and then right like over his shoulder through that little pane window of the door, one of my coworkers was just standing there. So they were trying to do the Robin, but the client was continuing, like even though I knew him, he was on some substances and he wasn't doing so well, and he kept escalating, and I was very concerned that he really was going to hurt somebody, myself maybe. And so I was trying to give them the look, like call the police, and then they were like, what? And I was like, what? I finally literally had to run around the client and say, open the door and say, call the police. Oh, okay, I'll call them. But you really need to, if you need to, that's why it's so important to, go in teams and then everybody know what's going on in the team. We're all on the same page, right, before we go into, because it's always after a code green that we learn, oh, we shouldn't do this anymore. So you're learning from 17 years worth of experiences on this end. So we're going to get to more. The other thing is that, and this is really a hard thing for any adult, is that you can always end a conversation. And people are like, what do you mean? Well, like, it's in polite society, you never just stop talking to somebody. You just don't do it. Like, it's just, but sometimes you need to stop. Like, if something's really going on and it's bad and you're fearful for your life, stop the conversation, right? And then just exit. And that's okay. If you are to the point where you're like, that the more you talk to this individual, the more escalated they get. Like, I can de-escalate like nobody's business. But there are those clients, either because of substances or psychosis or mania, that I could talk to them for 5 hours and it will never happen. And they just keep getting more and more and more and more escalated. We had a client last week who came in and no matter what I did, it wasn't working. I was putting all the stops, throwing all the magic dust on the situation, and it still ended with them throwing chairs against the window and throwing tables and we so no amount of de-escalation will work for some individuals. And so when it comes to the point where you realize the more you talk to them, the more agitated they get, it's okay to stop, right? And then regroup and figure out what your next steps are. Okay, so many of the clients that you, or individuals that you'll be working with have paranoia, trauma, and they have repeatedly and often on a daily basis are mistreated by others. So they're very distrustful, even though you know that you're coming in with the purest heart and you have the best intentions for them and you can give them all the resources. It doesn't mean that they're going to trust you, and you have to realize that that's okay. So again, open-ended question: is there something that you need? Is there something we can do to help you? That's kind of a way to engage rather than saying, "Get off our front porch," right? It gives them the opportunity to realize, oh, this person's nice. This is a nice, caring person. But again, knowing what the boundaries are, right? How are we going to figure out what they need, tell them where they can go get it, and then educate them about what we can't do, which is we can't let you stay here. I'm sorry. I think it's up to the church or organization about how much you want to explain why. Sometimes it's just easier just to say, I'm sorry, we can't do that, and just leave it at that, rather than having to explain things and then they try to figure out a loophole into that situation or whatever. So, but that's, again, up to the church. The other thing is wants versus needs. So our needs are kind of encroaching on our wants. The thing is that clients, I say clients for me, but individuals are coming to you for something, or they're coming to your property for something, right? They're looking for a place to stay, or they want a meal, or they want, whatever it is that they are specifically coming for, a want that they have. And that, again, housing, clothing, bus fare. And this is something that it's this balancing act. Because the thing is that when I meet someone, what I'm looking at is what they need, right? They need housing. They need mental health medication. They need to stop using substances. Whatever it is, these are the things that I see as a social worker as the need. But the thing is that wants and needs are often not the same thing, right? And so what we're trying to figure out is what the person wants. And sometimes they will also, it'll become very apparent while you're talking to them what they need. But again, we can't force anything on anyone when it comes to that kind of stuff. I think it's really important that we recognize Um, Self-determination. That's a hard one. That's a real hard one. I have clients that I still work with from 17 years ago, right? And I could tell you, I could have told them 17 years ago what their needs were, what they needed to do to rectify the situation. But that is not what they wanted, right? So again, we listen to what they want, and if we can provide what they want, we provide that. But the thing is that unless someone is at imminent risk of hurting themselves or someone else, it is their life, right? It is their life. And so we are providing what we can, thank you. We are providing what we can provide. So okay. So this part's not showing up, but there are the resource manuals, and again, I believe it's on the Coalition's website. It will be on the Coalition's website in the next couple of days or week. But there is a resource manual that I compiled with Tiny Heron. She has a list of outreach services, like churches and organizations. And then all of the street tip information is in the resource manual, along with some other resources. So it's like jam-packed. I also put photos of each of the soup kitchens and photos of each of the shelters from Google Maps. So there's at least that way you can actually show people, like, this is where you're going, with their address and phone numbers and times and stuff like that. Again, because I think it's super important that we know what we're presenting to clients. And so when they present a need, we know if there's a resource for them. The other thing I think it's really, really important to say is to say, oh, all you need to do is call this bed reservation line and they'll get you a bed. Or, oh, you just go over to the Common Assessment team and they'll help you with housing. Yeah. So the thing is that I know we love helping people. And we want there to be an easy solution to people's problems. But there usually is not. Other than, I'm hungry. Okay, then go here and you'll have something to eat. But nowadays, unless it's white flag, and white flag in Louisville means that if the temperature is under a certain temperature, which I think is like 35, 32, 35, or somewhere around in there, or above like 90 degrees, something like that. If it's white flag, then they will allow more people than usually they would allow. So if it's extreme temperatures, then they put the white flag out, that means pretty much anybody can come in. But if it's not that, so if it's a night where it's 40 degrees at night, or in the summer it's 89 degrees, then the shelters are often full. And so that means if the shelter's full, it means there is no room in the inn, and there is no place to stay. It amazes me that, as many resources as we have, how we still have such a need. Often, if you call the Coalition for the Homeless Bed Reservation line and say, I have a family, they're going to say, we're going to put them on the waiting list. Yeah, we have a waiting list for family shelters. So it's, it is, again, the need is amazing. So we have to be very, very cautious of what we say to people when we give them resources. Because it doesn't mean just because there's a resource that they're going to get an immediate need filled, unfortunately. So you can say, here, I think the Coalition reservation line is open from 10 to 4, I believe. I think that's the, so if you have a phone and you feel comfortable, you could, let's call and see if we can get you a bed. Or you can walk over to the Coalition for, they're at 4th and Ormsby. They take walk-ins. They can try to get you a bed right over there. It's just, 1 block over. Here it is on this, here's a picture of it. Just go over there any day from 10 to, I think it's either 10 to 4 or 10 to 2:30. But educating yourself on what's available and then not over-promising anyone anything. That's just very important. Okay. Help me understand what you need. And again, just knowing when they give you the response, again, it goes back to what your role is with them. I think it's so important, because I think you may not be the person, like your role may not even be to give them resources. It just depends on your role. Avoid use statements if you can. Like, you need to leave. If you would just listen. If you would just do what I told you to do last time, we wouldn't be in this situation. Avoid these things. These are ways of escalating individuals. Reiterate. So tell me if I got this right. It sounds like what you're saying, that you need help with this. Okay, let's see if we have any resources that might be helpful. And then recap. Okay, so I understand you're saying that this is going on, and that you're barred from these 2 shelters, but tonight's white flag, and so you should be able to come in. Okay. And the good thing is that I think most of us know this, but avoid getting into an argument with someone. If they need to be off the property, and you've instructed them, and they're you really need to be firm with what the boundaries are. If you allow them to stay one night, even though they're not supposed to stay any nights, then they're likely going to come back too. So again, it's important to understand where you are, what your policies are. Okay, all these things I think make sense. I don't think anyone here would be doing any of these things that we would have to worry about. Problem solving. Thank you for sharing this with me. Do you mind if I provide you with some information? Also asking them if it's okay. Say, oh, okay, I hear your situation. Is it okay for me to share this with you? And ask yourself, figure out what they want. Can we do that? Is there a middle ground? Okay, watch word choice. The other thing is that a lot of our clients that we deal with have learning issues. Some of them do. And so we have to break it down very simply. Thank you. Very, very simply, to make sure that they understand exactly what's going on. The next phase that we're going to take a break right now. When we come back is really the de-escalation and safety. And I think that's the thing that is going to be probably the most important thing for all of us moving forward when we interact with clients. So there's refreshments, again, right through this door here to your left, and bathrooms. And when we come back, we're going to get into the de-escalation and safety. Thank you.